Okay. Coming back to this session, this is a part two of a musculoskeletal syndrome of menopause series that we had started some time back. And we have got a very eminent and prominent doctor in this space, Dr. Rajesh Verma, who is doing this second session with us. The first focused on, overall musculoskeletal syndrome and the silent killer osteoporosis and your spine related issues. And today we will be touching upon the rest of the part of the body which have been very common complaints which are coming up, the knees, the shoulders, and heel issues. So over to you, Dr. Verma. It will be fantastic if you could, just introduce yourself. I mean, I know you now, but it'll be great for our, the people on this call to get to know you a little better.
Good morning and happy Sunday, everyone. I am Rajesh Verma. I am an orthopedic spine and joint replacement surgeon working at Gurgaon, various hospitals for last 22 to 23 years. Currently, I am with Marengo Asia Hospital, which used to be W Pratiksha for last 3 years. Before that, I was with Narayana Hospital in DLF Phase 3. And from 2008 to 2018, I was heading the unit at Artemis Hospital in Sector 51. So my main interest lies in spine disorders, joint replacement surgeries, minimally invasive techniques, and I have a very keen interest in musculoskeletal disorders, particularly osteoporosis and postmenopausal issues. So I'm regularly participating in community participations. I keep posting on YouTube and Facebook about the general issues regarding these problems. So thanks again, everyone, for joining in such a drawn. Really happy to be with us.
We are very happy to have you here with us. So, just for everybody's sake, Dr. Rajesh has really supported the cause Bloom stands for, which is basically creating awareness and information around different aspects which can affect a woman while going through perimenopause and reaching the menopause phase. So, I'm very, I do touch base with him here and there to figure out how, we can do things. So, really appreciative of that, Dr. Rajesh. So
No
I think
problem.
without much ado, we can get into the session that we are here for today.
So we'll keep it in similar format.
Yes.
Initially, I'll put few slides to make about the anatomy clear and few things which we are going to discuss. Before that, I'll touch base upon the last presentation, the important slides which we had discussed, so that those who have missed can be aware about those problems, because most of the problems are related to, if we specifically talk about postmenopausal syndrome, it is mainly related to osteoporosis, sarcopenia, arthralgias, back pain, and then we go on and talk about shoulder problems, hip problems, and knee problems. So I'll try to share my screen here.
And while the screen is being shared, this is going to be a very, very interactive session. So please feel free to ask questions once we, open it for the audience. So we would like you guys to interact with doctor and get as much information as you need.
Yeah, that will be great. We'll keep more time for the question sessions, question answers, one-to-one queries we can discuss in person. But anything general problems we want to discuss one-to-one, I'll be more than happy to discuss about those things. So this is my presentation. So I'll be talking about tips and advice for healthy aging and especially related to postmenopausal problems. So as we all know that 70% of females experience musculoskeletal symptoms and 25% will be disabled by them. Most common problems are arthralgia. Arthralgia doesn't mean osteoarthritis. Osteoarthritis can happen to anyone, and it's related to age, postmenopause, rheumatoid arthritis, and other issues. But arthralgia is a non-specific joint pain. This can happen in elderly people, but there are so many publications related to it because of deficiency of estrogen. There is a complex interaction between sex hormones, pain pathways, and chondrocytes and osteogenerator bones, and there are so many factors which can affect and lead to arthralgia. Loss of muscle mass, also known as sarcopenia. So we keep discussing about osteoporosis and osteopenia, but sarcopenia is a bigger menace than osteoporosis and osteopenia. So everything, weak muscles, weak bones, arthralgia, lack of exercises, elderly people leads to osteoarthritis, and this overall symptoms are considered as a part of musculoskeletal syndrome of menopause. Everyone should be aware of this problem, and we discussed in our last presentation about the big elephant in the room, which is the silent big elephant, which is nothing else than osteoporosis. Osteoporosis is the biggest epidemic which is currently on, and it mainly affects the elderly people, especially the postmenopausal ladies, because of the estrogen hormone deficiency. The calcium doesn't go into the bone as it should go properly, and bones become weak gradually. And this is not as silent as we know. There is worldwide an osteoporotic fracture occurs every 3 seconds. So every 3 seconds means like it's too much. As we are talking, fractures are happening, and happening. But good news about osteoporosis is that it's preventable, whatever the age may be, whatever the causes may be. So essential parts of preventing and treating osteoporosis are healthy diet rich in calcium, vitamin D, weight-bearing exercises. Being aware of the osteoporosis, you should need to discuss about these problems with your doctor and try to find about the severity of osteoporosis by getting your bone density and other tests done. So also I discussed briefly about FRAX score. FRAX score is nothing but fracture risk assessment over next 10 years. It essentially is a free online tool which anyone can access, and it's very easy to assess. This is much more important and better tool than getting your DEXA scan done and anything else. So you can just type FRAX score on Google and you can read this questionnaire and put the inputs like number one is you need to put your age, then your gender, then weight in kilograms, height in centimeters. Then there are five, six things everyone should understand and know that these are the high risk patients. If someone has had a previous fracture, any kind of fracture without any big trauma is included in that, like a distal radius fracture, spine fracture, hip fracture, and also history of parent fractured hip. If your either of parent had previously some fracture in the hip joint, that will again be considered as a high risk. Current smoking, steroid intake, many of us have had steroid intake during the corona epidemic. History of rheumatoid arthritis is a very big risk. It leads to so much of problem in the bones, and bones are very liable to become osteoporotic. Secondary osteoporosis is one thing. Secondary osteoporosis means it is because of some pre-existing comorbidities like diabetes, Crohn's disease, malabsorption syndrome, gonadal insufficiency in males. Other drugs which we take commonly like pentoside, anti-epileptic drugs. If someone is having these kind of problems, he will be considered positive for this column. Alcohol intake of more than 3 units per day is again a big risk factor. Then if you have a femoral bone density report, you can put it here. And then this chart is just if you calculate, press calculate, you will get this number here. So how to read FRAX score is that there are two columns here. One is major osteoporotic fracture. If the ratio is more than percentage is more than 20%, you will be considered high risk for osteoporosis and you need to start medications as early as possible. So FRAX score is very important tool. We must be aware about this and we should be able to calculate it on our own. Then we discussed about vitamin D. Why vitamin D is so essential for calcium absorption. It leads to stimulation of calcium to get absorbed from our GI system, and also it inhibits its excretion from the urine or from the kidneys. So vitamin D is extremely important not only for bones and muscles, but it has been found that those who are having a lot of sadness, depression issues can be correlated and can be directly related to vitamin D. Also, daytime sleepiness, overall thakan rehna is also considered a symptom of vitamin D deficiency. Extreme crankiness, before you blame your grouchiness or crankiness on PMS syndrome, you must know that vitamin D affects level of serotonin in your brain and this can lead to and impact your mood. Also, muscular weakness, decreased endurance, high blood pressure and cardiac muscle activity is also associated with vitamin D deficiency. Greater pain sensitivity again is related with vitamin D. So there are so many vitamin D receptors which are day to day found in all our systems. It leads to low immunity, T cell immunity issues, heart problems. So vitamin D is one vitamin or hormone that everyone should have get their level checked and should replenish themselves with vitamin D. Other than vitamin D, obviously vitamin B12 is extremely important for nervous system and nerve tissue. So we also discussed a lot of thing about calcium last time, how to take calcium, how much calcium to take, and who are the people who must take calcium, whether their calcium levels are low or high. That group consists of only four persons. One is lactating mothers, pregnant ladies, post-menopausal women, anyone who is 50, 55 plus, whatever calcium levels in the body they have, they are candidate. They must take calcium regularly, lifelong. There is no, you cannot just avoid this. You have to take it. And there are other certain situations after fractures where we can give short-term vitamin calcium supplements or certain people who are deficient with calcium then only. But there are three people, lactating mothers, pregnant ladies, and postmenopausal women must take calcium supplements. Which kind of calcium supplements, when to take, we have already discussed. If you want, we can discuss in our question answer session. After osteoporosis, back pain is the most common problem which happen in postmenopausal age group. And how to prevent back pain is extremely important. Exercise, stretching, good posture, regular weight bearing exercises is extremely important for the back pain prevention. So most of the time people ask me about this problem that what exercises are good for the elderly people. So any weight bearing exercises is good for elderly people, not only to prevent back pain, but also the osteoporosis. So there are two types of weight bearing exercises. One is high impact exercise. These are weight bearing exercises which you are seeing on your screens. These could be of two types. High impact exercises are running, jogging, dancing, brisk walk. Then there are low impact exercises like hiking, jumping rope, aerobics, stair climbing. How does it help? Exercises help in improving the bone strength by triggering bone forming cells and it boosts the bone density. Also, it fortifies our bone, which balances and helps in bone building. So we should, everyone should do exercises. Always start slow, focus on cooling down and warming up to prevent further injuries. Then little bit about ergonomics, how to sit properly, how to do regular stretch. Yoga is extremely important, not only for stretching, but it helps in balance. So I have put a small video on my YouTube channel. It's accessible to anyone. So these are the regular exercises which we do, like knee to chest, single knee to chest, both knee to chest, bridge post, side stretching, cobra pose, bhujangasana. All these are extremely important. If someone is already having back pain or knee pain, they should always consult a specialist before embarking upon these stretches. Sometimes they can be harmful in weak bones. And when you have a knee arthritis, you should avoid bending extremes of knee flexion. Sitting cross leg or in Vajrasana positions may be harmful for those who are already having pain. If someone is not having the pains, they can do all these exercises if they are comfortable with. Then always the importance of along with exercise, posture care, yoga, there is always a role for meditation and for prevention of psychosomatic issues. Nowadays, everyone is struggling with psychosomatic issues. So we must do some kind of meditation, some chanting, any kind of meditation process you follow that is going to help you. That also prevents Alzheimer's, Parkinson's, and nerve-related issues. So combination of strength exercise, stretching, yoga, meditation must be essential for everyone. That also helps in mood elevation and relieving the PMS syndrome symptoms. Then a lot of people ask me about acupuncture, acupressure. So I don't have any issues with that, but there are a lot of, it's an unregulated space. A lot of physiotherapists, chiropractors, they are embarking these therapies without having proper knowledge. So you should do your own personal research before getting all these fancy things done to your body. These can be harmful most of the time if not done properly. So now we come to the other problems which are seen in musculoskeletal syndrome. Most of the problem, bulk of the problems are related to shoulder joint and knee joints. But as we know, there are so many other tissues like bursa or small fluid-filled spaces around all the bony surfaces which can get inflamed. This commonly known as bursitis. This can be of various kind. It can be tennis elbow, golfer's elbow, carpal tunnel syndrome, CM joint arthritis, and the heel joint we see retrocalcaneal bursitis, plantar fasciitis, bunion problem. In the wrist also we see various kinds of decoherence disease, tenosynovitis, constricting tenosynovitis, trigger finger, and around the hip joint also we see trochanteric bursitis, which is extremely common. So we are going to speak little bit about each problems. If we talk about shoulder joint, this is a complex joint, unlike the knee joint where there is only two types of movements, only flexion and extension. But in shoulder, it's a highly mobile joint. It can move around all the flexion, extension, rotations, extremes. So it's a complex joint made of three bones. One is the clavicle bone, there is acromion here, and this is the scapula, which is flat bone behind our chest wall, and this is the arm bone. So there are two joints here. One is the parent glenohumeral joint, which is the proper shoulder joint, but there are two other small joints, which is AC joint or acromioclavicular joint. Between the parent shoulder joint and the AC joint, there is a potential gap here, which is occupied by this blue structure, which is bursa. This is normal fluid cavity that helps in smooth gliding movements of the muscles and keeps our shoulder pain free in extremes of flexion extension, even if we are lifting heavy weights. This muscle, which you see here, pink muscle, is part of rotator cuff. Rotator cuff is a group of five muscles which surround our shoulder muscles, and the injuries to rotator cuff are extremely common. So that's the anatomy part of rotator cuff. Then we all know about the deltoid muscle, which overlaps all the rotator cuff and surrounds the joint. Then the biceps muscle is there. So we keep talking about frozen shoulder. Frozen shoulder doesn't mean that it's a cold or frozen shoulder in that sense, but this means it's a spectrum of disease where the shoulder movements start decreasing gradually. Initially, it is known as adhesive capsulitis because our shoulder joint is all the joints are bound by a strong capsular structure, which is just like a thick structure of around 1 to 2 mm. It's a fibrocartilaginous tissue which surround our shoulder joint. And in frozen shoulder, it starts with some adhesions. The capsule starts shrinking and is known as adhesive capsulitis. Patients usually present with decreased movement, and in extremes of movement, it will be quite painful. स्पेशली एक्सटर्नल रोटेशन एंड एबडक्शन, जैसे कि हाथ को बाहर घुमाएंगे या ऊपर उठाएंगे तो काफ़ी ज़्यादा पेन होगा, और हाथ को पीछे ले जाने में ब्रिंगिंग योर आर्म एंड फोर आर्म बिहाइंड योर बैक विल बी एक्सट्रीमली पेनफुल. ये पेनफुल सिंड्रोम ज़्यादातर लोगों को रात को ज़्यादा तंग करता है. व्हेन सराउंडिंग मसल्स डेल्टॉइड ट्रेपीजियस एंड अदर मसल्स दे रिलैक्स ड्यूरिंग स्लीप, देन द पेनफुल कैप्सूल बिकम्स एक्सट्रीमली पेनफुल. एंड तभी बोलते हैं कि रात को पेन ज़्यादा होता है, मूवमेंट्स ग्रेजुअली डिक्रीज हो जाती हैं, और ये ज़्यादातर उन पेशेंट्स में देखा जाता है जो कि डायबिटीज़ हैं, जिनको थायराइड का प्रॉब्लम है या ऑलरेडी मस्कुलर वीकनेस है, एंड पोस्ट मेनोपॉजल सिंड्रोम में भी इंक्लूडेड है, क्योंकि इसमें देयर इज अ कॉम्प्लेक्स इंटरेक्शन बिटवीन डेफिशिएंसी ऑफ ईस्ट्रोजन and pain pathways and the capsular structure in chondrocytes. So frozen shoulder is the end point of adhesive capsulite where the capsule shrinks completely and it does not allow even a 1 degree of movements. Completely frozen, your arm will be along your chest and it will be extremely painful. अगर शुरू में इसको पकड़ा जाए तो अच्छे से ठीक किया जा सकता है मेडिकल मैनेजमेंट से, फिजियोथेरेपी से, हॉट पैक्स, आइस पैक्स, और जैसे जैसे डिले होता जाता है प्रॉब्लम्स बढ़ती जाती हैं। बट जो अपने आप जो एडिजिव कैप्सुलाइटिस होती है, जो कि विदाउट ट्रॉमा, विदाउट एनी इनिशिएटिंग फैक्टर होती है, उसका एक साइकिल होता है दैट टेक्स अराउंड 9 months to 1 year। शुरू के 3 महीने में बहुत ज़्यादा पेन होता है, देन 3 to 7 months इसकी मूवमेंट्स रिस्ट्रिक्ट हो जाती हैं, बट पेन कम हो जाता है, और लास्ट के 8 to 10 months में ग्रेजुअली ये रिजोल्व हो जाता है। बट सरप्राइजिंगली ये देखा गया है कि जैसे ही एक साइड का पेन ठीक होगा, अदर साइड में शुरू हो जाता है। तो यू शुड बी अवेयर ऑफ दिस प्रॉब्लम। Adhesive capsulitis or frozen shoulder, it lasts 9 to 12 months. And once one side gets better, there is a liability and possibility that other side will also get involved. प्रिवेंट करने का लिए यही है कि जब भी पेन होता है तो वी शुड प्रिवेंट फर्दर लॉस ऑफ मूवमेंट। रेगुलर स्ट्रेचिंग एक्सरसाइजेस इसमें करना चाहिए, जिसमें कि पेंडुलम एक्सरसाइजेस, आप आगे झुक जाएं और शोल्डर को अपने वेट के साथ लटकने दें और धीरे धीरे करके उसको मूव करना है आगे पीछे, और छोटा छोटा सर्कल बनाएं, पहले छोटा सर्कल, फिर इस सर्कल को बढ़ाते जाएं, जिसको कि पेंडुलम एक्सरसाइजेस बोलते हैं। ये एक एंटी ग्रेविटी पोजीशन में लेके आता है शोल्डर को, और यू कैन, दीज आर द इजीएस्ट एक्सरसाइजेस टू स्टार्ट विद, बिकॉज पेन इतना होता है कि एकदम से आप स्ट्रेच करेंगे या कोई फोर्सफुली करने की कोशिश करेगा तो प्रॉब्लम बढ़ जाती है। तो दिस शुड बी डन अंडर द गाइडेंस ऑफ ए ट्रेन्ड फिजियोथेरेपिस्ट और फ्रॉम ए ऑर्थोपेडिक सर्जन। Then once your movements are regained, then you can do cross body arm stretches, arm circles, shoulder flexion, like this pulley exercises are there. And once you are recovered significantly, then you can try to regain all the lost movements gradually. इसमें पेन मेडिकेशंस का बड़ा इंपॉर्टेंट रोल है। आपको लिबरल पेन मेडिकेशन लेना पड़ता है। इफ देयर आर नो कॉन्ट्राइंडिकेशंस फॉर एनएसएडी, दिस वर्क वंडरफुली वेल, लाइक paracetamol, brufen, Vobran, etocoxib, any pain medication, but it should be taken under the guidance of a trained doctor. Then we can give small injections in the shoulder. There are various types of injection. One is steroid injection, other is PRP, which is platelet-rich plasma. Then there are viscosupplement injections. सो स्टेरॉइड और पीआरपी इंजेक्शन से बिल्कुल नहीं डरना चाहिए। अगर इंडिकेटेड है तो बहुत अच्छा काम करते हैं, शोल्डर से एकदम से फ्री हो जाता है। Then, as I was telling you about the rotator cuff, this is a supraspinatus muscle, extremely important in initiating the abduction. ये वाला मसल डेल्टॉइड मसल के साथ साथ काम करता है, शुरू की 10 to 15 डिग्री आर्म को बाहर लेके जाने में हेल्प करता है, जिसको कि एबडक्शन मूवमेंट बोलते हैं। ये बहुत कॉमनली रप्चर होता है, यहाँ पर डिजनरेशन होता है, खासकर जिम में जो लोग जाते हैं जिनकी मसल्स ऑलरेडी वीक हैं, डायबिटिक हैं, थायराइड का प्रॉब्लम है, या कोई जिम ट्रेनर ने रॉन्गली स्ट्रेच कर दिया, या आपने कोई ओवरहेड एक्टिविटी की। स्पेशली आई सी लॉट ऑफ एल्डरली पीपल जो कि जिम नहीं जाते हैं, सडनली जिम जाना शुरू करते हैं, ट्रेनर की गाइडेंस, मिस गाइडेंस के अंदर ये रोटेटर कफ टियर हो जाते हैं। ओवरहेड एक्टिविटी, जैसे कि प्लेन में जा रहे हैं, आपने एकदम से कोई हैवी बैग ऊपर से उठाने की कोशिश की, वहाँ कोई हेल्प होती नहीं है, तो यू शुड नेवर हेजिटेट इन आस्किंग द हेल्प, स्पेशली वाइल यू आर ट्रैवलिंग बाय एयर। जो ओवरहेड एक्टिविटी है वो सबसे बिग रिस्क फैक्टर होता है, क्योंकि हैवी बैग आपने एकदम से उठाया तो पूरा आप में इतना स्ट्रेंथ है नहीं, एकदम से झटका लग के वो नीचे आता है, उस झटका लगने से रोटेटर कफ टियर हो जाता है। अनफॉर्चुनेटली रोटेटर कफ टियर ठीक अपने आप होता नहीं है, इसको सर्जिकली ठीक करना पड़ता है। गुड थिंग है कि आजकल हम ये सारी सर्जरीज टेलीस्कोपिकली कर देते हैं, जिसको आर्थ्रोस्कोपिक सर्जरी बोलते हैं। छोटे छोटे 2-3 टाइनी होल्स करते हैं और उसको स्यूचर एंकर से करके फिर धीरे धीरे करके एक्सरसाइज प्रोटोकॉल बताते हैं। Then coming to the common tenosynovitis, bursitis problem. One is tennis elbow, extremely common problem which pain happens around the outer aspect of our elbow. अंदर की तरफ पेन होता है उसको गोल्फर्स एल्बो बोलते हैं. वैसे ये सेल्फ लिमिटिंग है प्रॉब्लम. इट टेक्स 3 to 6 weeks. It will disappear on its own. Mostly it is because of the stress, repetitive movements in the gym while playing. So you have to stop those movements, postures, offending postures needs to be avoided. Then only it will get better. पेन मेडिकेशन लेना होता है. टेनिस एल्बो बैंड, अल्ट्रासोनिक मसाज बाय फिजियोथेरेपिस्ट, स्ट्रेचिंग डज हेल्प. एक्सट्रीम केसेस में जहाँ ठीक नहीं होता है वहाँ फिर हमें स्टेरॉइड का छोटा सा शॉट या पीआरपी का इंजेक्शन लगाते हैं. उससे एकदम से डिसअपियर हो जाता है. अनदर कॉमन प्रॉब्लम इज ट्रिगर फिंगर. आवर फिंगर्स हैव स्ट्रॉन्ग टेंडन्स विच मेक अस फ्लेक्शन एंड एक्सटेंशन. ईच टेंडन मूव्स इन ए शीथ. उसको साइनोवियल शीथ बोलते हैं. उस शीथ में एक लिक्विड होता है, जेली होती है छोटा सा, अराउंड 0.5 ml. वो लुब्रिकेंट की तरह काम करता है. समटाइम्स वो शीथ ड्राई अप हो जाती है और वहाँ पर कंस्ट्रिक्शन बैंड बन जाते हैं. तो जो फिंगर बैंड तो हो जाएगी बट सीधा नहीं होगा, उसको अटक जाती है. उसको ट्रिगर फिंगर बोलते हैं. ट्रिगर थंब भी हो सकता है. कॉमनली इंडेक्स फिंगर, मिडिल फिंगर में होता है. 90% केसेस में लोकल मसाज से, पेन मेडिकेशन लेने से, हॉट पैक्स करने से ठीक हो जाता है. बट उससे ठीक नहीं होता तो यहाँ पर भी हम छोटा सा एक इंजेक्शन लगाते हैं, उससे ठीक हो जाता है. अदरवाइज लोकल एनेस्थीसिया में टाइट पुली को रिलीज करते हैं, उससे भी ठीक हो जाता है. तो सेल्फ लिमिटिंग है ये सारी प्रॉब्लम्स, बट ठीक नहीं होती, लंबे टाइम तक रहती हैं, तो फिर इसको हम इंजेक्शन से या सर्जरी से ठीक कर सकते हैं. Carpal tunnel syndrome. Carpal tunnel syndrome, again, I will say is very, very common, especially in elderly people, more than 50 years, females, little heavier weight, fluid retention का जिनका टेंडेंसी होता है. तो यहाँ पर रिस्ट में एक fascia होता है, ट्रांसवर्स कार्पल लिगामेंट, जो कि फ्रंट ऑफ रिस्ट में होता है, जहाँ हमारा रिस्ट का स्ट्रैप होता है एग्जैक्टली वहीं पर होता है. तो ये स्ट्रैप अगर टाइट हो जाए, ये फ्लेक्सर रेटिनोकुलम अगर टाइट हो जाता है, तो यहाँ से मीडियन नर्व जाती है जो कि थंब, इंडेक्स, मिडल एंड हाफ ऑफ रिंग फिंगर को सप्लाई करती है. तो इसमें पेशेंट्स को टिंगलिंग, बर्निंग, पेन, स्पेशली ड्यूरिंग नाइट, और ये पेन हाथ से निकल के शोल्डर की तरफ, नेक की तरफ भी जाता है. इस नीड्स टू बी symptoms needs to be differentiated from cervical disc problem and other nerve problems. इसमें भी वही बात है कि हम इनिशियली पेशेंट को बोलते हैं कि एक रिस्ट को अगर हम सीधा रखेंगे सोते हुए, तो ये चीज़ें काफ़ी रिजॉल्व हो जाती हैं. जैसे हम सोते हैं तो सभी के हाथ आगे की तरफ मुड़ते हैं, फ्लेक्शन में आ जाते हैं, और उस फ्लेक्स एटीट्यूड में, फ्लेक्स पोस्चर में नर्व्स पिंच होती है. तभी पेशेंट बोलते हैं कि सुबह-सुबह जब हम उठते हैं, सुबह के 3, 4, 5 बजे सबसे ज़्यादा पेन होता है, बाद में थोड़ा-थोड़ा करके ठीक हो जाता है. तो इसका सिंपलेस्ट तरीका यही है कि इसको रात को एक क्रेप बैंडेज या कोई कार्पल टनल स्प्लिंट आता है, रात को वो लगा के सोएं, ताकि कलाई आपकी आगे की तरफ ना मुड़े. अगर सीधी रहेगी तो ये सिम्पटम्स धीरे-धीरे करके ठीक हो जाते हैं. एडवांस केसेस में सर्जरी भी करना पड़ता है. इनिशियली हम इंजेक्शन लगाते हैं. Good thing about surgery again is that we are nowadays doing everything by endoscope. With a very small incision of less than 1 centimeter, we can put a small endoscope and release the carpal tunnel, and with very good outcomes. So now coming upon and discussing a little bit about osteoarthritis. Osteo means bones, arthritis means inflammation around the joints. Very commonly affects knee joint, hip, shoulder, and then there is a small joint, thumb का जो joint होता है उसको carpo metacarpal joint बोलते हैं, CM joint of thumb, which is again a very common arthritic area. Then we need to differentiate osteoarthritis from inflammatory arthritis. Out of that is commonest is the rheumatoid arthritis, ankylosing spondylitis, gouty arthritis, and any synovial joint in body can get affected by osteoarthritis. Knee joint again is a complex joint. It has three bones. One is the thigh bone, femur bone. Another one is the tibia or the leg bone. And the small bone is the patella, which is kneecap. If you'll see here, this is the normal knee joint. Yeah, yellow and orange things are the bone, and this blue thing is the cartilage, which is around 3 to 4 millimeter thick. It surrounds the end of the femur bone and the tibia. In between cartilage, there are three, four important structures. These horseshoe shaped structures are meniscus. There is one meniscus on the inner aspect of the knee, another on the outer aspect. And these are the strong ligaments. Two ligaments are inside the joint, which are known as cruciate ligament, and two ligaments are on the out of the joint, which is medial collateral and lateral collateral. And wherever these ligaments and muscles insert, there are small bursa that can also get inflamed. I'll talk about that also. So this was the normal joint. Now we are seeing the arthritic joint. Arthritis means degeneration of the cartilage. The ends of our bone where the joint is formed is there is a cartilage here, and gradually this cartilage wears down. As we grow old, slowly, these cartilage wear down. This wear and tear can be aggravated by previous trauma. If you are a sports person, you are more liable to develop these cartilage injuries in your sports days. Any previous meniscus damage, ligament tear can lead to arthritis. So whenever there is a meniscus tear in young life or even in around 40, 45 years age, that should be treated as early as possible to prevent future arthritis. तो ये जो गैप आपको दिखाई दे रहा है इसकी वेरियस स्टेजेस होती हैं that can be seen on x-rays. So like normal knee would look like this because on X-ray we see only the bone. In between two bones there should be a clear gap which should be equal all around. This is medial compartment. This is the center part where the ligaments are there, and this is the lateral compartment. So this is normal knee. In early arthritis, the medial compartment जो अंदर वाला घुटने का हिस्सा होता है सबसे ज़्यादा उसमें arthritis होती है. लेटरल कंपार्टमेंट सबसे बाद में इन्वॉल्व होता है. सबसे पहले मीडियल कंपार्टमेंट या पेटेलोफीमोरल जॉइंट जो होता है, नी कैप वाला जो जॉइंट होता है, वो इन्वॉल्व होता है. तो सबसे पहले पेशेंट बताते हैं पेन इनर साइड ऑफ द नी, थोड़ा टेंडरनेस होगा, रेडनेस भी हो सकता है. धीरे धीरे करके मूवमेंट डिक्रीज होता है और स्टेयर क्लाइंबिंग में, स्क्वाट करके उठने में, बैठ के उठने में या ज़्यादा देर बैठ के उठ रहे हैं तो पेन होगा. जैसे जैसे एडवांस होती है स्टेज, लेटरल कंपार्टमेंट भी इन्वॉल्व हो जाता है, मूवमेंट्स रिस्ट्रिक्ट हो जाती हैं, फिर धीरे धीरे करके पाँव टेढ़ा होना शुरू हो जाता है. तो एडवांस आर्थराइटिस में आप देखेंगे तो नी की शेप टेढ़ी हो जाती है, प्रॉपर चल नहीं पाते. एक टिपिकल टाइप ऑफ गेट जिसको वेडलिंग गेट बोलते हैं वो होता है. और फिर काफ़ी जब पेन होता है तो उसमें हमें नी जॉइंट रिप्लेसमेंट का ज़रूरत पड़ता है. बट उससे पहले, नी जॉइंट रिप्लेसमेंट से पहले, देयर आर सो मेनी थिंग्स विच कैन बी डन. वन ऑफ द मोस्ट इम्पॉर्टेंट थिंग इज टू डू रेगुलर एक्सरसाइजेज. उसमें आपको क्वाड्रिसेप्स की एक्सरसाइज जैसे साइकिलिंग जो चला रहे हैं, स्विमिंग कर रहे हैं, अंडर वाटर वॉकिंग करना है. नॉर्मल वॉक इज ऑल्सो वेरी गुड एक्सरसाइज. साइकिलिंग, क्रॉस ट्रेनर आप कर सकते हैं. बट जो इम्पैक्ट वाली एक्सरसाइजेज होती हैं, रनिंग, जंपिंग, स्क्वाटिंग, क्रॉस लेग सिटिंग, वो हम बोलते हैं जिनको नी आर्थराइटिस सेटल इन हो गया उनको अवॉइड करना चाहिए. Then next line of treatment is about the injections. There are so many kinds of injections available nowadays. One common injection nowadays used is platelet-rich plasma. इसमें पेशेंट का ही ब्लड लेके अराउंड 20 to 30 ml उसको मशीन में प्रोसेस करते हैं, फिर उसको हम नी जॉइंट के अंदर इंजेक्ट कर देते हैं. दिस इज द वन ऑफ द सेफेस्ट टेक्निक and shown promising results in early arthritis, which is known to heal the early cartilage defects. Along with that, we can give steroids when there is an acute inflammation or there is a lot of fluid inside the joints. Steroids are wonderful drug if used properly. We use it very commonly, steroid, but it has to be done under the good supervision of a trained doctor. Then synthetic lubricant injections are also available that lubricates our joint and make them healthy. They stimulate normal chondrocytes also and prevent further loss of cartilage loss. Like they will not stop the arthritis, but they can definitely delay the onset or delay the need of you can say knee joint replacement. Then nowadays we are using stem cells also, and radio frequency is a special kind of laser which we put inside the joint and block the genicular nerve which supply the knee joint. So if required, these are very good methods, especially in relatively younger people where you really want to delay the arthritis. When only medial compartment is deranged, then we just replace the medial compartment. This is known as partial knee replacement or half knee replacement. जैसे कि यहाँ पर दो पेशेंट में मैं आपको दिखा रहा हूँ, इसमें सिर्फ हाफ नी जॉइंट रिप्लेस करते हैं और पेशेंट काफ़ी बार पूछते हैं कि क्या नी जॉइंट रिप्लेसमेंट के बाद फुल मूवमेंट आ जाता है। तो आप इस लेडी में देख रहे हैं, शी कैन डू फुल स्क्वाट्स, full cross leg sitting. She's as good as she used to be before. Full flexion. She's a house lady from some village. She can do all. Even she is using Indian toilet, and we are allowing her to do. So with good technology, good early pickup of the patient, if surgery is done properly, we can really give as normal movement as they have. And partially का advantage ये है कि you get full movements. There is not even reduction of 1 degree of movement. This is just 3 days after the surgery. She is so happy about this. And I have operated many patients from village backgrounds. They are driving tractors, doing farming work, hard work, squat, cross leg, running, jumping. You can play tennis. Any activity can be done with unicondylar knee replacement, but this is not possible with total knee joint replacement, where you have to replace both the ends of the femur as well as tibia and kneecap. तो इसमें भी काफ़ी अच्छा आउटकम है, especially when we are using the robotic technology nowadays that helps in reduction, giving the perfect alignment, and it usually stays, the good result stays around 20 to 25 years. Very important surgery. It will be required. I am very candidly saying that even I will require knee joint replacement surgery because longevity is increasing, our life expectancy is increasing, and cartilage wear and tear is going to happen. Other than arthritis, as we were discussing about the bursitis, there are so many small fluid filled cavity around the knee joint. So these bursa, they can get inflamed. So these needs to be differentiated from arthritis because the treatment is totally different. Most of them are self-limiting, or with a small injection they can heal. Another common problem in 40 to 45, 50 years of age is the chondromalacia patella. Our kneecap is also bound by small cartilage here. That cartilage gets swollen, inflamed. इसको chondromalacia patella बोलते हैं. इसमें जो सिम्टम्स आता है, अर्लीस्ट सिम्टम ये होता है कि जब बैठ के पेशेंट खड़ा होता है तो उसको पेन लगता है, फिर थोड़ी देर चलेगा तो फिर ठीक हो जाएगा. इसको थिएटर साइन भी बोलते थे. जैसे हम लास्ट मूवी देखने जाते हैं तो 2-3 घंटे एक जगह पर बैठना होता है, तो जैसे ही पेशेंट उठता था या कोई भी उठता है तो उसको इस तरह का पेन होता है. तो इसकी कुछ स्पेसिफिक एक्सरसाइजेज होती हैं जिसको कि क्वाड्रिसेप्स हैमस्ट्रिंग के अलावा इसमें हम MPFL, मीडियल पेटेलोफीमोरल लिगामेंट एक्सरसाइजेज बोलते हैं, जो कि यूट्यूब पर अवेलेबल है. MPFL एक्सरसाइज करके कॉन्ड्रोमलेशिया को ठीक किया जा सकता है. सिमिलर बर्सास or fluid filled cavities are also present all the bony prominence. Out of that, one of the commonestly inflamed bursa is trochanteric bursitis. ये हिप जॉइंट के बिल्कुल बाहर वाले एस्पेक्ट पे होता है, जो हम बोन को फील भी कर सकते हैं. इसमें सिम्टम्स यही होता है कि जब पेशेंट गाड़ी से बाहर निकलते हैं या सिंगल लेग पे खड़े होकर ड्रेस चेंज करते हैं तो काफ़ी पेनफुल होता है. सिमिलरली एक बर्सा होता है इशियल बर्सा, जो कि हम जहाँ बैठते हैं, जो बोन सपोर्ट करती है सिटिंग पोस्चर में, उस एरिया में जो बर्सा होता है वो इन्फ्लेम हो जाता है, तो उसको इशियल बर्साइटिस बोलते हैं. फुट एंड एंकल में देर आर 3 थिंग्स. वन इज दिस हेगलैंड डिफॉर्मिटी और रेट्रोकैल्केनियल बर्सा, जो कि हील के बैक में होता है, जहाँ पर हमारा शू का एंड होता है ऊपर. तो उस एरिया में काफ़ी पेनफुल होता है, तो उसको बोलते हैं रेट्रोकैल्केनियल बर्साइटिस. फुट के नीचे, हील के नीचे जो प्लांटर एस्पेक्ट है, सोल वाला हिस्सा पीछे एडी का, उसको बोलते हैं प्लांटर फेशियाइटिस. ग्रेट टो के जंक्शन पे जो इन्फ्लेमेशन हो उसको बनियन भी बोलते हैं, बाद में हेलेक्स वेल्गस बोलते हैं. Similar to carpal tunnel syndrome, there is a nerve here which is known as tarsal tunnel syndrome. अगर ये नर्व यहाँ पर प्रेस हो जाती है तो उसमें भी बर्निंग, इन्फ्लेमेशन, पेनफुल सिंड्रोम, रात में ज़्यादा होना. तो इनके कैसे ट्रीट करना है इनको? रेट्रोकैल्केनियल प्लांटर फर्साइटिस के लिए देर आर 2-3 स्ट्रेटजीज. वन इज आइस कोल्ड एंड हॉट पैक्स, ऑल्टरनेट बाथ बोलते हैं, कॉन्ट्रास्ट बाथ, 1 मिनट पानी गर्म में रखते हैं, फिर ठंडा, फिर गर्म ठंडा। और सिलिकॉन के स्पेशल हील पैड्स आते हैं आजकल, एयर हील्स भी आते हैं, एयर पैड्स आते हैं। और जिनको ठीक नहीं होता उसके उन केसेस में हम छोटा सा इंजेक्शन भी लगा देते हैं यहाँ पर। बनियन के केस में भी यही होता है कि यूरिक एसिड के लेवल्स को आपको मॉनिटर करना है, उसको रूल आउट करना है, प्लेन एक्सरे करके देखना है, ज़रूरत पड़ने पर इंजेक्शन या लेयर। In refractory cases, we have to do a small surgery to make them straight and remove the bursa. I think I'm done with the presentation. We can discuss about these things.
So thank you so much, Doctor. There are lots and lots of information that has come over here. Now we're going to open to questions. Some questions are there in the
I'll
chat, and
stop
I can,
sharing the screen.
yeah, I will just ask. हाँ जी, बिल्कुल. So I'm going to just ask the people who put the questions to ask their questions, and anybody else can also ask. There is somebody called A. There are a couple of questions from A, so maybe you could just go and ask. Go ahead.
Okay, why don't I ask? My name is
Yeah.
Asha Kapoor
Hi.
Mehta, so I'm part of the A's. My question was, I had synovial fluid leakage in my knee during COVID time, and I've, through exercises, the towel being placed below the knee, and that kind of thing, I've managed to keep it under control. But is there anything else that one should be doing?
So synovial fluid leakage or synovial fluid collection? Leakage is like coming out of the fluid. It should be a effusion in the knee, like swelling in the knee with.
There was swelling in the knee.
Yeah. So this is known as synovitis or synovial fluid effusion. So most of the time it will be self-limiting. If you have to rule out like common causes of synovial fluid accumulation, which is arthritis, rheumatoid arthritis, any injury, or gouty arthritis where high uric acid levels are there. So if those things are ruled out, it will subside on its own. You should do just ice pack, take some anti-inflammatory medications, ultrasonic massage. Sometimes you need to just
एक
lie down.
सेकंड आशु एक सेकंड hello doctor, can I ask my question?
Sure, sure.
Sorry, excuse me. Actually, there's a question going on with.
Okay.
We can just
Okay.
finish that if that's
Sure,
okay.
sure,
I
sure.
think I am done with the synovitis question.
Yeah. Asha, do you have any other follow-up thing before we move on?
No, I think he's answered the question. Thank you so much.
Great. Thank you very much. So now, A
Yeah.
can ask. And A, what's your name?
Yeah, my name is Aarti Sahai
Aarti.
and I am 50 years old.
Mhm.
So the problem is I am in the menopausal stage. I have shown to the gynecologist. They have given me vitamin D3, calcium, and B12 to take. My thyroid reports are fine. But my nails are so brittle that even if I'm picking up a glass, they cut from the between, I don't know what to do.
No, this is not related to any of the problems which we were discussing. This is something related to nail issue, which you need to see a dermatologist.
Okay.
Yeah, this is totally different thing.
Okay. Though I don't put any nail paint, nothing on my nails, because I'm very scared that, something happens.
This is not very common problem. You please discuss it with some good dermatologist.
Okay.
He will be able to.
Okay. And also, doctor, one more thing. In the morning when I get up, the side of my foot, the left foot, that pains a lot. Then few initial steps that I take are difficult, and then I start walking.
So this is again the similar problem which we were discussing. This is the plantar fasciitis. So please follow those instructions: ice bath, hot and cold packs, and it will get better on its own. And you can take some anti-inflammatory medicine. Need to check your uric acid levels. But if it persists, you should do one X-ray and see a doctor.
Okay, sure, I will do that. Thank you, doctor.
Thank you.
Can I ask one question?
Malvika, I'm done with my question.
Okay,
thank you.
Great. Thank you.
Yeah, Pooja this side.
Pooja, just a second. There were some people who just put their questions. I'll just finish off with those and then we'll come to all of you guys. You can just raise your hand and just be there. Ruchika, do you want to ask your question?
Good morning, doctor.
Good morning.
Dr. Rajesh, when I get up in the morning, so in the morning there's a kind of a pressing pain under the breast near the diaphragm, and it goes behind. So especially when the winter sets in, beginning of the November and till December, and I when I get up, it feels there's a difficulty in breathing also because the diaphragm area pains a lot. But by the time when I get onto the routine work and the day is okay, the entire day it's fine. But night and the morning, when I get up in the morning, then the pain is very excruciating.
Yeah, it could be costochondritis, which is not an uncommon problem, where the rib attaches with the sternum. There is a small joint which is known as costochondral junction. So these are extremely painful. But even if you press that area, it will be painful. So strategy should be to just do hot packs or some ointment you can apply. Do good breathing exercise. Try to do a lot of stretching that area, and some pain medication can help. If it is not like resolving on its own, you must see a doctor to rule out anything related to the internal organs and breast tissue, because we can't online tell everything about that. But in costochondritis, this is quite common: early morning pains and stretching pains, and it gets better on its own.
Okay. Thank you
Yeah.
so much, doctor.
Okay, Parul, would you like to very quickly ask your question?
So if
Parul
no
has
one
a
is asking,
question.
I
Yeah.
am reading the question from the meeting chat.
Yeah. Does
There are two
calcium
questions.
supplements really help in bone health? How can we take care of joint lubricants?
Which calcium and D3 supplements should we take, and at what frequency? There's one question about that. Let me answer that question first. So any calcium like calcium carbonate, CCM, Jamcal, Shalcal, any commercially or like over-the-counter available calcium having 500 elemental calcium one should take. And any vitamin D3 supplement like Lumia, there are so many trade names, 60,000 units once a week for 3 months, then it should be taken once a month. But like you need to check your vitamin D levels first. The report will come into nanogram. Normal range is 30 to 100 nanograms. If your results are like say 10 nanogram, then you need to take 20 weeks of weekly 60,000 units. And after that, to maintain that, you need to take once a month. So calcium supplement, again, I will reiterate, it should not be taken by everyone. It should be taken by proven postmenopausal ladies, lactating mothers, and pregnant ladies only, not for anyone.
And there's something about joint lubricants. How can
Yeah,
we take?
joint lubricants are used for early arthritis. These are glucosamine and chondroitin along with diasterin. So these are very effective medications. Glucosamine and chondroitin sulfate, they stimulate the normal chondrocytes. They help in maintaining the normal cartilage and delaying the progression of the disease. This can be taken continuously for 3 to 6 months. Then you can take a break. Then again you can start according to the advice given by your doctor.
Okay, great. Konika, do you want to ask your question?
Yeah, thank you. First of all, great presentation, Dr. Rajesh.
Thank you.
There is, I've started developing, there's a kind of a tingling or a burning under the foot sometimes, and especially when I'm traveling quite a lot because my work involves a lot of travel. And then I also find that 2 or 3 of my foot, fingers, the toes, etc., they become very stiff. And suddenly there's a very bad cramp, and I'm hardly able to move. So I don't know, is it related to this or is it related to something else?
Yeah, 3, 4 things for your case. You need to rule out diabetes. You need to rule out any kind of neuropathy, any alcohol and smoking, liver function derangements. Then we need to focus on the local problems that can be because of tarsal tunnel syndrome, some pressure around the nerve, painful nerve, or metatarsalgia. So in relatively flat feet patient who are wearing high heels, sometimes
Yeah,
that
I have a
could.
flat foot.
Yeah, there are so many things which need to be checked upon: systemic cause, local cause, and body weight, and so many. So better would be to seek a neurologist or orthopedic surgeon
Sure,
opinion to find
sure.
about the cause.
Sure, sure. Because my mother has a has vasculitis. So I don't know whether that
Yeah,
is
yes.
something that kind of gets passed
Yeah.
on. Is that hereditary or
And it
possibility of?
should be diagnosed as early as possible. So please don't delay it. You
Sure,
must seek opinion.
sure. Thank you so much. Thanks a
Thank you.
lot.
Let's take some of the people who've raised their hands now, maybe Yoshita, and then we'll come back to the other questions also, which are there.
Okay, thank you, Rajesh, Dr. Rajesh. It was really, really very insightful. I have two questions. One
Sure.
is, if my hereditary, just hereditary related, that if we have mother, grandmother, grandparents all having arthritis, does that mean that I am doomed to have arthritis, or is there something that one can do in our 40s, 50s so that we delay it or we don't get it? I'm practicing yoga, that's one thing. And also, a related question is, because you mentioned walking and you mentioned not doing high impact stuff. So I'm also learning Kathak, and Kathak is a pretty high impact dance, classical dance, where you have to keep hitting the foot on the floor with a lot of force. So yeah, these are the two things, kind of.
So about the first question, there are certain papers which say that there is some hereditary component involved for osteoarthritis. But believe you me, would you say menopause is hereditary? Would you say aging is hereditary, or would you say dying is hereditary? No, they are not. So as we grow old, wear and tear is going to happen. So I don't believe that osteoarthritis per se is hereditary. It mostly depends upon your like lifestyle, whether you are doing regular stretching, walking exercises, and taking care of your joints or not. So there is no big evidence in support of hereditary osteoarthritis per se, but definitely other kind of arthritis like ankylosing spondylitis, inflammatory arthritis, rheumatoid arthritis, they are hereditary. Coming to the second question, Kathak dance, I would not say it is high impact. These are like small foot tapping movements that should not be high impact. High impact will be running, jumping. Tennis is high impact. Running is high impact. Playing soccer and all those things are high impact, where there is sudden twisting and turning movements. So if you are really think that with the Kathak dance you are having pains exaggerated, then you can slow down. Otherwise, I would not believe that it's a high intensity.
Okay, thank you. Thanks so much.
Thank you.
Okay, let's move on. Snimmer, what you would like to ask?
Yes, thank you. I have two or three questions actually, doctor. I'm 70, almost 72 years old. I have
That's good. You are remembering three questions at a stretch. It may be hard for me to remember.
I might forget the third one, but let me start with the first one. About calcium, how do we know we have a deficiency? And
You are deficient,
I
ma'am. Anyone who is 50 plus, females are deficient, believe you me. This is proven, this is recommended. You just cannot fulfill your requirements by taking diet. Whether you even swim in a calcium pool, you will not be able to make your insufficiency complete. You have to take,
right.
yeah.
So this serum calcium test is meaningless for
A serum
somebody my
calcium
age.
test is sham. It shows
Okay.
only the blood levels. Even
Yes.
if, because if the blood levels fall, we will die. We cannot survive without sodium, calcium. These are element. There are two types of calcium. One is ionic calcium, which is in the blood, which will
Right.
never go down because body bones will keep providing extra calcium to the survival. So it
Ah.
is the
Okay.
calcium in the bone which can be checked only by doing bone density in fresh starting.
Right, understood. Thank you. And related to that, I have read that calcium can also get deposited in your arteries. Is this a genuine risk at my age, or I should continue taking supplements?
No,
I'm
no.
also diabetic, hypertensive, hypothyroid, thyroid, all those things.
That calcium is a different कोलेस्ट्रॉल वाला कैल्शियम जिनको ऑलरेडी डेफिशिएंसी है उनको ये प्रॉब्लम नहीं होता है बट इफ ए पर्सन लाइक मी who doesn't have any deficiency start taking calcium 2 times a day, then there is a risk that there can be increased risk of renal stones and cardiac issues. But for a female 55, 60, 70 years, taking 500 milligram of calcium is not going to add to the cardiac risk. But if you have a specific tendency, then you should speak to your cardiologist. Otherwise, not. This is not a general recommendation from my side for those who are
Right.
already having cardiac problems.
Right. Thank you, doctor. My second question is knee related. I have had arthritis in my left knee for more than 20 years, which goes back to an early injury in that knee.
Mm-hmm.
So I have been managing it. Recently, I have been having this problem, which you specifically mentioned about getting up from a sitting position, or at night, if I sleep with my knee bent on my
Mm-hmm.
side, then when I turn over or straighten it, I get pain
Have
on
you
one
got your
side of the
X-ray
body.
done, ma'am? Have you got your X-ray done?
I did consult an orthopedist recently,
Mm-hmm.
and he looked at it and said, this is arthritis and you don't need a knee replacement as yet, and do this exercise and SOS, take a painkiller.
So please consider any of the injections which we are talking about that should help
Okay.
you, and along with exercises.
Okay.
Yeah.
Thank you, doctor. Third question. I have recently developed a bunion on my right foot. Now,
Mm-hmm.
what causes bunion? I mean, my uric acid was normal.
Is it
Is it
painful or not?
something? Uh, Not really, but in some
Then
position,
don't talk
something.
about it. Just forget it.
Okay.
So it's
Okay.
just aging phenomena. As we grow old, foot will get deranged, small arthritis. Bunions are known to happen in adolescent girls also who wear crooked type of shoes, but they are painless. We never treat painless bunions. If it
Right.
becomes painful, then you should consult. Otherwise, don't worry about the bunions.
What about, I have seen some advertisements for correctors that straighten the toe. If the big toe gets out of alignment, is that the underlying cause? I don't wear high heels or anything,
No, 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 no,
but
no. I am saying if it is painful, then you can use those correctors, but they are difficult to use. Your gait becomes awkward. You have to be careful.
uh-huh.
Then there can be
Right.
sweating. There can be problems related to that. So
Okay.
please avoid doing anything if something is not paining you, is not
Okay.
hurting you.
And
If you
thank you,
want,
doctor.
yeah,
Crux of the matter is if it is not worrisome, don't make it a problem.
yeah.
Suruchi, would you like to go next?
Yes. Hello, doctor.
Hi.
I wanted to talk about two things. In the last year, I've started noticing, my body starting to speak to me. So my knees started to pain suddenly after getting up, and I did physio for 5, 6 months. It helped little bit, but I started swimming. That helped me quite a lot. But my knees are kind of weak. And the other thing is that I get, like for the last few weeks, my neck and back and all are so stiff. So for months, I am very energetic. Everything is fine, and then suddenly something happens, and then for a few months, it's always dealing with pain and all. I work out with a trainer 3 days a week. I was swimming till the pool was open 3 days a week. But and I've had months of excellent health with my body, bones, muscles, and then suddenly everything is wrong. So I don't understand how to deal with this.
So you must have done your vitamin D, B12 levels checked. Are they fine?
Normally, my vitamin D is low, and I supplement it twice a year.
So sometimes vitamin D itself, as I was explaining, it can lead
Yeah.
to all kinds of problems which we are trying to explain. But I will not blame everything on vitamin D.
Mhm.
Maybe some mild arthritis is going on, something related to the fibromyalgia disorders or some disc problems. So keep doing exercises, take supplements, and get some stretching done by some physiotherapist. Join some yoga, and if there are some specific symptoms which you really need to probe, you should do some X-ray or MRI for that, so that we are guided in a better way to help you out.
Okay. Thank
Yeah.
you.
Sonia, please. Sonia, would you like to go next?
Yes. Thank you. Doctor, hi. I loved your slides. I love the humor in the slides.
Thank you.
So, so I have two questions. One is for me and one's for my mom. I'm 52. My mother's 80.
Okay.
For me, the question is that I have some bumps on my knuckles, on my thumb and my forefinger on my right hand, and they hurt when I press them.
So these bumps are just below the nail area or at the knuckles area?
It is in the second segment. for my forefinger, and it is just below the nail in my thumb.
Below the nail. So these are known as Haberden nodes. These have a specific name, Haberden nodes. These are part of arthritis.
Okay. So
Yeah.
this is
So this
arthritis.
indicates small like arthritis is going on. So if they are
Mm.
painful, then you need to take some pain medications.
Okay.
Keep doing stretching and exercises of the fingers. Take
Okay.
a small exercise ball or tennis ball, do some exercises with that. And
Okay.
these are early indicators, like you must have seen some cholesterol deposit near the eye. So these are similar to that, and they indicate more liability to get arthritis. So please be careful. Do a lot of exercises for the knee, shoulders, and hip stretching as well. And you can start taking glucosamine and chondroitin as we were discussing about those visco tablets.
Okay. Okay. Thank you. For my mother, she has arthritis, and the doctor's on the fence on both rheumatoid and osteo. And what she's had for a while is swollen knees. As you were saying, the fluid
Yeah.
accumulates, the synovial fluid. And because of that, one doctor said knee surgery will be okay. One says it doesn't. It isn't required. So for knee surgery, she has sarcopenia as well.
Yeah.
So chicken and the egg. Should the
It all depends whether she's 80 or 70 years, that really doesn't matter. If
Okay.
it's excruciatingly painful and hurting and restricting her day to day life, and she has to take pain medications,
Mhm.
and she has a will to live pain free life, then definitely she'll require a knee replacement surgery or some kind of intervention. Although I haven't seen her x rays, but
Mm.
I assume it should be significant arthritis in her case.
Right. I
So
think I'll
don't
bring her
take
to you.
age as a number, but if
Mm.
it's really hurting her, then you should consider some kind of intervention.
Yeah, maybe Sonia, you could get an appointment and show
Absolutely.
the reports to the doctor. I think that
Yes.
would be
Thank
better.
you. Yes. Yes. Thank you so much.
Okay, Pooja, would you like to go next? I'm just
Yes,
taking it
please.
in the order
Yeah.
which is coming on the
Yes, yes.
screen. Yeah.
Yeah, yes. Hi, good afternoon.
Yeah.
Actually, I'm having knee pain since 5, 6 years. I am 45 years of age right now. So
Mhm.
I'm in perimenopause phase. So I did couple of x-rays, like a couple of times, showed to the doctor. They said that it is osteoarthritis, like the gap has like reduced. But I go for treks every Saturday. I go do yoga. I do all the exercise. Oh, it's only that beyond a certain position, like bending, I get pain, like while climbing stairs and while bending my knee to extreme. So it gets locked. So what should be done for that?
I don't think it is osteoarthritis. It's related to some kind of bursitis or some ligament strain in specific postures you are having in 45 years of age. If you are having such kind of symptoms, this usually is not because of arthritis. It could be some kind of bursitis. Sometimes there is small fluid cavity behind your knee, which is known as Baker cyst or popliteal cyst. Have you got your X-ray, ultrasound, or MRI done? Because in young age,
X-ray, yeah, not MRI, but X-ray couple of times, yes.
no,
So
no.
they said the knee gap, like it has reduced the between the two
Please get your
joints.
MRI done. That will be more informative because when age is not in favor of osteoarthritis diagnosis, we try to find out why it is so much of painful.
Okay.
MRI would be a better investigation for you.
Okay.
Yeah,
Thank you.
thank you.
Okay, Suchi, would you like to ask?
Yeah, hi.
Hi.
So my problem is that on my right toe, the first segment, of the bone, from that point, I've started having pain and then it radiates towards the heel. So, and this aggravates while walking mostly. Or even if I wear like half-inch heel also, even then, or wear any footwear which has sort of a band that covers the toe. So I'm not able to wear any type of shoe, even broad shoe, I'm able to just about manage, but it hurts. So this is recent. So it's not all the time, it's mostly while walking.
So it
So
seems to be some kind of variant of plantar fasciitis along with metatarsalgia. Should continue, start doing those hot and cold fermentation, take pain medication, and should get your standing x-rays, weight bearing x-rays, AP lateral views.
Okay.
Sometimes there is bony outgrowth that can lead to this kind of symptoms. So this is not correctly fitting into the plantar fasciitis, heel pain, and all those issues.
No heel pain at all.
Yeah,
And
yeah.
there's no growth also, visible
It's
growth.
better
I've
to
shown
do
to the
one
doctor,
plain
so no
X-ray
growth.
in standing. That can help us.
Okay. Thank you, doctor.
Yeah.
Okay, thanks. Deepti, would you like to go next?
Yeah. So my question was related to all the knee questions that are there. I've already had a serum injection about 3 years back, and I've been quite regular with exercising and diet control, high protein diet, etc. But the pain is getting too much over the last year. I did get my X-ray and MRI done. There is no gap that has increased, but there is excessive pain. So, and I'm like doing a lot of strength training, which helps when I do it. But then during the day, while I'm sitting and everything, the pain returns, and it's a perpetual. So, my question was that do this that are the plasma injections, etc., do they have to be repeated on a regular basis, or do I need to do something else?
Yeah, plasma injection. The worst part with plasma injection is that you have to take 3 consecutive injections with a gap of 1 month, PRP. And then it has to be repeated again. Every year you have to take 3 consecutive injections if there is a real indications of PRP.
Oh, okay. I've only had there was a serum injection that was there, not plasma. So does that also
Serum,
have to
did
be
they
repeated in
take
the
blood
same
out of
frequency?
you? Did they take blood?
No, no,
No. Then it's not a
no.
serum injection. It could be viscosupplement injection, commercially available. It usually costs 15 to 20,000, around 3 to 6 ml of viscosupplement, lubricant injection you are talking about.
Okay.
It should be repeated every 6 months to 1 year.
All right. Got that.
Thank
Okay.
you.
And even if there is no cartilage damage, should that be repeated?
No, I won't say that. It has to be seen by a doctor. If they think the gap is little reduced and on MRI there is evidence of cartilage damage, then only it should be used. Otherwise, normally it will.
Okay. Thank you, doctor. Thank you.
Sapna Aunty, would you like to go next?
Yes. Dr. Rajesh, you were very informative and we've learned a lot from that as well. My question is about the supplements. So the thing is that I was taking CCM initially. I'm 63 years old. So I was taking CCM earlier. And what happened was that I got this renal calculi, the kidney stone. And then the doctor said that maybe it is because of the excessive use of D3 thing. Because that I think there is or maybe I was taking a 1000 IU on a daily basis with vitamin D3. So I got very scared after that. So I am taking the 60,000 IU once a week. I'm not sure whether to take a supplement of calcium, which also has a D3 supplement. I mean, my question is whether a supplement of calcium and D3 should be taken together or a calcium supplement should be taken separately and a 60,000 IU supplement should be taken separately.
Yeah, I got your question. So 60,000 unit has to be taken once a week for 3 months. Then you have to take only 2,000 units daily or 60,000 unit monthly. That is separate to the calcium supplement, which only has 200 to 400 IU. It never has 1,000 units in it. If your calcium supplement itself is having 1,000 units, then you don't have to take separately the vitamin D supplement.
All right. The second question is the multivitamins that we take. Sometimes there are multivitamins. Right now I was taking the Ambe multivitamins. That also has 150 mg of the calcium. Now, the 500 milligram of 500 milligram of calcium should be taken over and above this multivite, or I mean, is that too much of calcium? My question is whether we are taking too much
I got your
multivite.
question. I am saying that If you are taking so many other supplements, then try to take your calcium supplement only 20 days in a month. Don't take
Okay.
excessive.
All right. But that should be taken over and above these at least
Yeah,
20 days in a month.
absolutely. Unless it is said no specifically by your urosurgeon or a kidney doctor. Sometimes there are some kind of urine stones, kidney stones, which are specifically made by oxalate or uric acid. Then there are various kinds of calcium supplements. CCM is calcium citrate palliate. Then calcium carbonate is there. Calcium oxalate is there. So you need to check with your kidney doctor if you have specific.
All right. Thank you. The one more question I have is about, my knee. Once in a while, I get this pain and I apply some kind of either a hot or cold fermentation or some oil, which is the oil related, and it does get relief. Now, could it be muscle or could it be bone only? I mean, I'm confused about that.
In 63 year, it should be combination of both the things, arthritis
Okay.
along with sarcopenia. So hot packs does help in muscular pain as well as chronic joint pains. Whenever is any acute pain is there, redness, inflammation, fall, trauma, sprain, splint, anything, then you should not apply heat. You should use ice pack over it for
All
small
right.
time.
All right. Thank you so much, Doctor. Thank you.
Thank you.
Great. Rina, you have a question. I think there's a long thing you've written. I think maybe you could ask it yourself.
Yeah, hi. I'd written the same actually. I'm 51. My pain started good when I was 46. I had early menopause around 45, 46 years of age. So I've been having this knee, which I'm told it's osteoarthritis. Uh, but I can't figure out, the solution to my problem. I've been to the best of doctors. Unfortunately, I can't still find relief. I've been very active. I've been, working out. I've been into yoga. I've been into, aerobics. But there's no relief in pain. I took this injection also, which was a lubricant, which doctor was telling to the other lady. But no relief from that lubrication injection either. So now I'm using this brace, which I'm told that might, help with the alignment. My knee is also a little curved in the sense that it doesn't straighten completely because of the pain.
So if there is no arthritis in the joint,
There
then you
is.
can
That's
do
what
that.
I'm told.
Yeah, there are two types of things. One is bony arthritis, another is some damage to the meniscus or cartilage only. If there is bony deformity, there's osteophyte formation as you are describing, there are some bumps inside the knee.
Yes, that
Then
is
the
also there.
minor procedure which you meant must be arthroscopic surgery where we put a
Yeah, yeah,
telescope
yeah.
inside. So it does help when there is some mechanical blocks, like if there is some tear in the meniscus or something is really blocking inside the joint, then these procedures are very, very helpful. But they are not good for proven osteoarthritis where predominant damage is to the cartilage. So you have to reconsult. Maybe you can speak to us. You can come over and we can
Yeah, I
examine.
had my MRI done some time back, and that showed third grade meniscus tear some time back, which
So
possibly
third
got
grade
correct.
meniscus tear means it's complete tear. And if
But
there is
that got
no
healed on its own
associated,
because it never, bothered me as such to, be able to, hamper my day-to-day life. That's very, very strange. But
so
maybe the
because
pain started after that.
grade 3 tears means there are 4 tears. Grade 1 is just a scratch over the meniscus. Grade 2 is like 50% damage. Grade 3 is 100% damage. And grade 4 is 100% damage along with separation of them. In your case, a loose flap is there which is flapping inside the joint and is causing damage to the joint. So you need to take care of that and you must meet a arthroscopic surgeon. You can come over and we can see and decide about that.
Okay, last few questions
Thank you.
that we could take. Otherwise,
Thank
you
you.
could always take an appointment with Dr. Rajesh at the hospital, Marenga Asia Hospital, Gurgaon. So I think Namita, would you've raised your hand. Do you want to ask?
Yes, hello. Thank you so much, doctor. My question is that uh, I exercise moderately and keep pretty much good health. I paint a lot, but whenever I sit down for long hours, yeah, something that involves sitting on the floor and doing some exercise or like being on the canvas for long, and then it's like my body is stuck. I can't move, and suddenly I realize that I'm not. the same as I used to be 10 years back. So, what could be, despite my doing yoga and keeping like a healthy lifestyle, is there something that I should get checked at this stage? Because frankly, I've not done anything. I do not take any supplements too. I know that I should.
Yeah, better to seek your opinion. And how old are you, ma'am?
I'm 53.
53 is a very young age to have all this. So if you are doing proper yoga, there is no question you should have this kind of problem. But
Yeah,
certain
but if
people
I'm
have
sitting down,
different kind of, muscular balance issue is there. Their muscles are so stiff. So it's better to seek your opinion maybe by a good physiotherapist or some trainer, or you can come to us. We can guide you regarding that. So these are
okay,
all non-specific things.
Yeah,
all
it's
right,
always better to get into a deeper consultation,
right.
yeah, and
Thank you.
investigate.
Initially, you should do your vitamin D levels and continue taking good diet, do stretching, yoga, everything.
Thank you. Thank you.
Thank you.
Okay, Asha, you have a follow-up question?
Yes, I do. I have two questions. One is that my vitamin D3 levels are 39. So do I need to supplement? And the
39
second,
nanogram or nanomoles?
I'll have to check. I
So please
don't.
check. If it is nanogram, you don't have to take anything regularly, just once a month, forever.
Okay. Okay. I'll
Whosoever is
check.
having vitamin D levels in a normal range, please take vitamin D 60,000 unit once a month forever. If you are staying in India, if you are abroad, then it's this not required because there is a food fortification there, which is not yet in India possible.
Got it.
So if your food is not fortified with vitamin D, you have to take yourself at least
I'll see.
2,000 units per day or 60,000 units per month.
Okay, got that. The other was, for a relative who is diabetic and has tingling in the feet. What is the solution for that?
Age of the patient?
68.
68. Nerve conduction studies have been done.
Yes,
Yeah.
those are fine.
So they have to take special medications like gabapentin, pregabalin, duloxetine, and better to meet a neurologist or a orthopedic spine surgeon who can guide them.
Okay.
Strict control of diabetes will help along with the medical management.
Diabetes is controlled.
Yeah. Then
So,
better to take special medications.
okay. Thank you very much.
Okay, I think we are done with all questions here, unless anybody has any last, because I know that Dr. Rajesh has another engagement after this, and he was kind enough to take out time.
No, that's all right. 12:30 till 12:30, I'm fine.
Yeah, okay. Asha, do you
Bye-bye.
have any
Start
other? There's
knocking
a
on the door.
No, I was trying to lower my
okay.
hand.
Cool, cool.
Thanks.
Okay, anybody else? Or are we good to go? All right, so great. The link to the previous video and to this video, I'll put them all on the group and as well as on the Facebook page. It's also going to be on the Bloom website, so you could always go and visit that. The first session has been divided into two parts just for the ease of recording. So you could go and take a look at that, and this one will also be put on the Bloom website. So thank you, everyone. I'm going to share the link of the Bloom website here as well. And thank you so much, Dr. Rajesh, for your time.
My pleasure. Thank you, everyone, for coming in such large numbers and being really interactive and asking questions. I loved that. Thank you so very much.
And also, because guys, please go ahead and consult the doctor at the hospital. You can call up the hospital and take an appointment. So thank you so much. And
Thank you.
from all of us at Bloom, signing off. Thank you, guys.
Thank you. Thanks, Malvika.